Hey everybody, Daniela here with High Healing and Wellness, and I wanted to talk about a topic that's so dear to me, and this is living beyond our diagnosis. So, what I want to discuss is when we are diagnosed, be that bipolar, personality disorder, um, PTSD, complex PTSD, when someone is given a very big diagnosis, it can be really detrimental to their well-being. They can become overwhelmed, they can begin to feel helpless. I'm bipolar. And so they start to identify. And I always urge all of my clients to not identify as your diagnosis, because your diagnosis is not you. Your diagnosis is something that you suffer from because you're currently exhibiting the symptomology. That's it. So just as in the medical profession, if a person goes into the doctor and they say, I have a fever, I have, a sore throat, I have this, the doctor's going to say, okay, you have a cold, you have a flu, you have this, that. Based on symptoms, they're going to give you a diagnosis. So does that mean I am the flu? Or does that mean I currently have the flu? So I really want to talk about that and making sure that as we go through our journey of healing, that we are recognizing that we are not our diagnosis. Our diagnosis is a really easy way for someone on the outside to explain our symptoms and possibly even find a positive way to treat those symptoms and help us have a better life. But it is not who we are. And it's also not an excuse to not better ourselves. It's not an excuse to move forward with our lives. And so I really want to talk about living beyond our diagnosis. And so oftentimes we find our diagnosis is a result of trauma. So we look at, I'll use for example, someone with borderline personality disorder. Borderline personality disorder in most cases is a result of extreme trauma during childhood, not being validated, neglect, major forms of abuse normally. So in reality, this person has developed a personality disorder that is a result of trauma. It is not just, this is who they are. This person, I am borderline, No. So a person is showing borderline symptomology because of the trauma they've been through. And so first we need to separate the behavior from the person. So when someone learns a maladaptive behavior, they learn it as a result of it working. So in our dysfunctional environment, this behavior suited us, it helped us, it increased our rate of survival. They were needed adaptations, right? So someone who's in an abusive environment has to learn to not be reactive and empathetic to others' feelings because it could be dangerous for them. Someone who's in danger it's completely normal to be hypervigilant and to be aware and to be constantly concerned about their surroundings. Later we call it PTSD when the person is still in that physical state and yet they're no longer in the physical danger. And that's what we label as either PTSD and then complex PTSD, depending on where it goes from there. But these labels are not people. These people are people, and they're people with trauma, and they're people who've been through things. And so I really want to focus on us learning to live beyond these diagnoses and not identifying with them. Not, a doctor saying that you're borderline does not mean I'm borderline and my life is over. No, a doctor said that you're exhibiting the symptoms of borderline personality disorder. And so we need to work on the trauma. So why? We need to get back to the root. I see so much work right now on treating the symptoms and not getting to the root of why these behaviors have become. And so it's just like in the medical profession, if we're just putting a Band-Aid and we're not getting rid of the infection that's underneath the skin, we're never gonna solve the actual problem long term. All we're gonna do is we're gonna medicate, we're gonna put Band-Aids on it, we're gonna continue to treat the symptoms. And that's exactly what a lot of the rushed mental health work is, and I've been in it, so I know, is treating symptoms. It's, I have 15 minutes in front of you, tell me what your symptoms are, let me give you a medication to make it feel better, to lessen that symptom, but we're not actually treating what's happening. We're not treating the person, we're not treating what they've been through, and they're not healing. And so they live their life exhibiting these symptomologies for the rest of their life. So my goal with our group here, with High Wellness and Healing, is to really work people towards learning to live past their diagnosis and treating that inner child that's within them and dealing with the hurt and the pain that has come forth, and making sure that we are dealing with the person and not a label. So labels often, if someone says, oh, that person's disabled, we immediately, oh, okay, that person can't do. No, that's not accurate. And so we want to make sure that we are not limiting ourselves, and we're not limiting those around us. If we have loved ones and friends and family, and that are suffering with a mental illness at this point, we want to make sure that we are, number one, we're being understanding. We're seeing that they're exhibiting behavior as a result of what they went through. And so we need to make sure that we remember that they are not their diagnosis. And as the person actually going through it, we need to remember we are not our diagnosis. We are healthy people. We have the potential to grow. We have the potential to be anything that we want to be. And so remembering that we have an obligation to live past our diagnosis, not with our diagnosis. So our diagnosis does not have to take permanent residence in our life. I am in no way saying going against doctor's orders, or stop treating, or stop following through on any of the treatment or any of the medications or anything that you're doing. But what I am saying is that we need to realize that there is a line between someone who has a disorder and somebody who is a disorder. And so that's what I wanted to talk about today, and making sure that we are living beyond our disorder, and we are no longer identifying with our disorder. We are going to say, I have, or I am suffering from, not I am bipolar, I am manic depressive, I am, I am borderline personality disorder, I am narcissistic. These are symptoms of a bigger problem, and almost always that problem is trauma, and the trauma is what we need to identify. So I really encourage everybody, if anyone has any questions, I provide individual sessions, and I'm available, and my goal is to help us work past whatever the symptoms that we're seeing and get to the root of that problem so we can heal and live our best lives. Thank you, and have a great day. Bye.